Hi, my name is Skylar Carlson, and I'm going to present to you my research from this semester on the effectiveness of implementing virtual reality simulations in nursing education. This is something that interests me as I am currently an instructor for a BSCN program in a rural community. Throughout the pandemic, nursing students have missed clinical placements, and simulations have provided a way to bridge the gap from theory to practice. My main research focus was around immersive virtual reality, which creates a 3D interactive environment, giving a sense of realistic presence to the user experiencing it. My PICO question that was used to guide my research over the semester was, what is the effectiveness of using virtual reality simulations with BSCN students in a rural community as a method to replace missed clinical experiences in conjunction with medium fidelity mannequin simulations? I found 4 quality articles in my search that consisted of 2 systematic reviews, 1 randomized control trial, and 1 quasi-experimental design. All the articles looked at the effectiveness of virtual reality as a teaching tool in nursing education. The total number of participants from all studies combined was over 3,500, and almost all the participants were nursing students, which is great. So the results can easily be transferred to my target population. The results of the studies were all favorable. There was a positive impact on students' knowledge, skills, and effective learning outcomes. The most improved outcomes were seen when VR was used to teach theoretical knowledge, so things such as health assessment, med administration, aseptic technique, and an improved knowledge retention overall among nursing students. I chose to use the diffusion of innovations theory to guide my intervention as it was the most applicable. This model includes strategies that are most effective based on my target population's characteristics. The suggested strategies that appealed to my population were success stories and evidence of the idea's effectiveness. So, my proposed intervention was to create a presentation around the effectiveness of VR with a live demo of the program and a success story from another institution's experience with using VR to supplement more than 10,000 clinical hours since their implementation in 2020. So, the goal of this intervention is aimed at gaining support from key stakeholders at my institution to move forward with this technology. Some of the barriers or challenges that were discussed around implementing VR were mainly around financial constraints, as it can be expensive. It requires special headsets and equipment and monitors, so it's not a feasible option for every institution. However, the research shows that the cost advantage overall has shown to be effective in comparison with mannequin based simulation. The user's attitude of the technology was discussed as well. Some people may be just more reluctant to adopt new technologies and less receptive to trying the VR simulations, and also these side effects. So, common side effects identified when using VR were cyber sickness, headaches, and eye strain. And these were mostly due to prolonged exposure. So, they recommend that the consecutive time spent using the VR equipment is limited to less than an hour at a time. Overall, that concludes my research for the semester. I hope you learned something new and I hope you enjoy it. Please let me know if you have any questions. Thank you.